I was diagnosed with quite an aggressive form of breast cancer at the start of last year, so coming up to 12 months ago. Because they couldn't diagnose a specific cause of the cancer, it meant that my treatment journey was going to be a lot longer than sort of some other cancers that have a prevention, that they know what's caused them. So this time last year I was faced with 5 months of chemotherapy, single mastectomy and 5 weeks of radiation, 25 radiation sessions. Following on from all of that treatment, I then had to take another 6 months of oral chemotherapy.
We're very, very fortunate to have a SOZO device here in the Allied Health Lymphedema Clinic, but we don't have one in the Cancer Care Centre, which happens to be over the opposite side of the hospital. It takes a good 5 minutes for me to walk over. So a patient who may well be fatigued during their cancer treatment, it might take nearly the whole appointment for us to walk over here if we need to use this device. So what we would like to do is to get a device in the Adam Crosbie Centre in order for us to be able to provide that for our patients.
Before radiation, I'd had all my lymph nodes removed. 21 lymph nodes were removed with my surgery, and because of the radiation, that meant I was at particular risk of lymphedema as well, which is where the fluid will build up in your arms. Your lymphatic system doesn't function properly, so the fluid builds up, which can become a lifelong condition. It's incurable if it gets to a severe stage. So fortunately, I was able to access the SOZO machine within my physio appointments, but that was all I could do because I was travelling to the other side of the hospital and back, and there was little time for any physical therapy in those appointments. But having access to that, to all of that data that the SOZO machine gives you, meant that I could see what my body was doing. I could see when the fluid was increasing, to put strategies in place to minimise that, which meant that I could get back to exercise safely, and build up some strength, which will hopefully, build better outcomes for the future.
That's what we're trying to do, broaden this tool to use across the whole community of cancer